Immunization remains a mainstay in safeguarding children's health worldwide, but achieving universal vaccination coverage has been a significant global challenge. In lower and middle-income countries, more than 12.4 million children received no vaccines in 2020, for instance. These vulnerable children, known as zero-dose children, account for a substantial portion of preventable deaths in children. Nigeria faces a particularly alarming situation amongst these countries, with over 2.2 million estimated zero-dose children in 2021. And these figures are most likely to have appreciated over the space of the last 2 years. Dr. Chris Esezobor is a professor of Pediatric and Pediatric Nephrology at the College of Medicine, University of Lagos. Well, he joins us now in our studio to have a quick chat. Good afternoon, and thank you for joining us on Newsday.
Thank you for having me.
Well, you know, these statistics in the last 2 years and more are quite interesting, if not a little scary. Could you tell us more about the immunization process in children?
They are actually dire, and dire in the sense that this is despite the fact that these vaccines are available in the country and available free of cost in all the local governments. And that's the shame. That's a big shame that our children are dying largely from preventable, what we call vaccine preventable diseases. Diseases that have been eliminated, eradicated in many parts of the world. The ongoing diphtheria epidemic in Nigeria is actually a shame of the country. More so because these vaccines have been available for more than 50 years and provided free. But we still have many children, many 1-year-old here in Nigeria, including Lagos, that have not received a single dose of these vaccines.
But then I'm wondering what's responsible for that. If the vaccines are available, if they are free, so is it that parents do not know about this vaccine? Do we need more awareness, probably in the rural areas? What would you say is responsible for the low rate of immunization?
So many things. Yes, we know that ignorance is there. Culture and religion also interplay to take the discourse in direction we do not want. For instance, the human papilloma virus, which is a rare opportunity for a cancer to be prevented. And these vaccines are now introduced into Nigeria, but we still hear all over the place, including on some TV stations, that those vaccines are targeted at reducing the fertility rate of our mothers. So that's one aspect of it. Insecurity is also playing a huge aspect. Some places are not easy to reach. They are underserved. The manpower is not there. Even where the manpower is available, is skewed in its distribution. We have some health centers that cannot open certain days of the week, even in southern part of Nigeria. We have some other health centers that cannot be open beyond a certain time because of insecurity. We have parents that have to live, they only feed on what they make every day. And if they go to the healthcare facility and there is any significant delay in them getting care, they would rather just go look for what the family would survive on and think that, oh, this is for something in the future, maybe we can do with it. So the reasons are many. But the point I want to highlight here to our listeners is that these vaccines are available. They are very effective. They've made differences in the life of children all over the world. A quick statistic, which is a sad commentary on us as a people. In Afghanistan, for instance, if 1,000 children are born today, only about 50 or 60 will not see their 5th birthday. In Nigeria, if 1,000 children are born today, 110, twice that number, will not get to their 5th birthday. Afghanistan has been in war for the most part of the last 4 decades or so. Yemen is doing better than us. It may even surprise you that Somalia may also be doing better than us. So something is fundamentally wrong. And we realize as the Pediatric Association of Nigeria that to tackle this, we need to get everybody on the table. It is not just the business of those that work in the hospital, the doctors, the nurses. No, it's everybody's responsibility. If we must safeguard the nation's best asset, which are our children, then we need to do everything. We need to collaborate with the media. We need to collaborate with people in the IT. Yes, the rural areas are always underserved. We need to find ways to reach them, to get them inclusive.
And not to cut you off, but that's very true because honestly, the unvaccinated population affect everyone else. And honestly, I've only seen it twice in my lifetime where vaccinations have become like a bad thing, namely during the COVID pandemic. We do remember that there was a lot of misinformation and confusion as to whether or not those vaccines would work. Some were fearing that it would trigger pre-existing health conditions in their bodies, as it had been reported there was a population of the world that really did get allergic to some of the injections. And then the second time I saw it was when there was the outbreak of measles in the US, with little kids. There was this whole thing that getting vaccines for babies would cause autism, and a lot of high net worth individuals were getting scared about this unknown disease affecting their children. And then you have schools that had measles, mumps, and rubella, sounding like it was the 1930s. There were outbreaks in these schools. So how does your organization go about battling the disinformation and dealing with the pockets of individuals who do get affected by these vaccinations negatively? Because it does happen, albeit a small percentage. How do you quell some of those fears?
Okay, so in the 55 years of the existence of our organization, and the meeting we will be having in January, titled PANCOF 2024, will be the 55th annual scientific conference of the Pediatric Association of Nigeria. And during this long, illustrious history, we have been able to influence the inclusion of many vaccines into our routine childhood immunization. But like we've rightly realized here, it takes more than providing these vaccines. It must get into the mouth of the children. Like somebody said, medicine doesn't work if it is not taken. And so these vaccines need to be taken. The issue of managing information, we are not experts. We may be content experts in that, but organizations like Arise TV are content experts in getting the right information into the ears of everybody that needs to hear it. And that's one reason why we're here. PANCOF 2024 would provide an avenue, not just for pediatricians, but for media practitioners, for experts in the IT space, for the organized private sector, and for government agencies. We need to be in the same room discussing these issues. Because when we're on the same table discussing the issues, we will listen to each other and we can co-create measures, strategies to improve on our dismal health indices. Dismal in the sense that countries like Niger have maybe a third of our GDP per capita, but our children are doing better. So something is wrong.
Now, just before we let you go, I'd like you to talk about Nigeria's pediatric care system as a whole. Is it adequate? Is it affordable? What are the challenges of pediatric care in Nigeria?
Pediatric care. So let me start with care for everybody. Care for everybody is actually suboptimal. Suboptimal in the sense that it is not effective. It is not reliable, meaning that if you get the same care today and you're happy with it, what are the chances that you get the same care the next day or if you move to another facility? Is it safe? Is it entirely safe? But despite the fact that it's not suboptimal, it's suboptimal for everybody. Children are particularly vulnerable. There are a lot of vaccines, even medications that are not available for children. They need the medications, the drugs, but the drugs come in formulation that young children can. So for instance, if a drug comes only in tablet form, the 1-year-old is not going to get that tablet swallowed. So we're providing for the adults gradually, but we seem to be forgetting the children. So whereas we would say adult care is suboptimal, children are actually faring worse than this. And so that is one, and that is why the team of PANCOV 2024 is trying to reach every child in Nigeria with optimal care. But everybody is invited to the table.
Are vaccines more dangerous for the child's body or an adult's body?
The child is more vulnerable when it comes to immunity because the adults have been exposed over time. And they say what doesn't kill you tend to make you stronger. So if an adult has been exposed to malaria all his life, as an adult he's much in a better place and being protected against malaria. But the young child is not so. And that's why they need vaccine. And because child health is closely allied to the mother's health, you also need to take care of the mother because the mother provides the initial vaccination, in quotes, in the first few months of life to the child. So if the mothers are also not getting their vaccines or did not get them when they were children, then they are not just only exposing themselves, they're also putting their unborn children at risk.
Now, earlier you talked about the HPV vaccine, and I know that in recent times we've seen some health workers going around schools, churches, trying to immunize the children. But I'd like you to tell our viewers, what is the importance of taking the HPV vaccines, especially for children, and between what ages? Is it, do they have to take several doses, or is it just one dose?
Okay. So in this part of the world, our women are dying largely from cervical cancer. Cervical cancer is one unique cancer that is driven by an infection. This infection is sexually transmitted. And so if you remain celibate all your life, you're not likely to get the human papillomavirus and be at risk. But irrespective of our religious affiliation, we know that the age at even sex, first sex, is actually lowered all over the world. It's a reality. Our children are getting sex much, much earlier, and people are getting more lifetime sex partners. And all those things increase your risk of contracting this virus. Whereas most people will be able to clear this virus, their immune system might be able to clear it. For a small number of people, the virus can persist in the body. And over time, can cause changes. Yes, the changes initially may not be cancer, and that's where pap smear is very important. But let's ask ourselves, how many of our mothers, again, for religious reasons and for many reasons, avail themselves of pap smear, which is a way of picking very early pre-cancerous form of cervical cancer. And so we need to adopt multiple strategies. And like I said, cervical cancer, breast cancer is not caused by viruses. We don't yet have vaccines for that. But cervical cancer is so unique that we have vaccines. And let me just tell my viewers, some 5-6 years ago, I have three girls. I have 3 girls, all adolescents. I paid for those vaccines from my pocket. And the one I even got for them is not as superior, so to say. Contained only 2 strains of the virus. The one the government is providing covers 4 of those strains. So it's even more effective, and government is providing. So they all have to take
several doses, or is it just one dose?
They have to take several doses spaced out. But what happens when it comes to implementation of vaccines, different countries based on costs, logistics, and other, adopt different regimen. Some would say 0, 2 months later, 6 months later. Some would adopt different regimen. But they need to take it. That is the message from us.
Dr. Chris Esezobor, very informative discussion we've had with you today. Thank you so much for coming in. He's the professor of pediatrics and nephrology in the University of Lagos College of Medicine.
University of First Choice and the nation's pride.
There we go. All right, good to have you.
Thank you very much.